Welcome to Clear on Health.
TSTV, connecting your.
Good evening, viewers. Welcome to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji, and I'll be your host this evening. With me in the studio is Dr. Talemo Da. He's a man of many colors. He's a consultant gynecologist, obstetrician. He would, be discussing some things with us this evening. So today we're going to be talking about endometriosis. Now, the month of March is known as Endometriosis Awareness Month. It's something that affects women all over the world, and we feel we should discuss it and bring your attention to it. So, sir, what is endometriosis?
Well, it's a word that describes the condition where you find the endometrium. Endometrium is the inner lining of the womb.
Yeah.
Where you find that inner lining of the womb outside the its normal place in the inner lining of the womb, then it's called endometriosis.
Okay.
That means that it's not in its normal place. But when you find it because in its normal place, it will shed out. But if it's found somewhere else, it's not going to get space to shed out. And if it is functional where it is, then it's called endometriosis. That is endo. It is within a condition where the kind of condition in the endometrium, in the inside of the womb, is found elsewhere.
Thank you so much for that answer, sir. So, sir, what's the prevalence of this disease condition?
Well, worldwide,
Okay.
it is said that about 176 million to 200 million people are suffering from it. But we know that either there is some underdiagnosis, and that is the reason why, like you said when you are introducing the subject, that it is World Awareness Month.
Yes.
Because many people are not aware. They assume that it is their normal body, that they are having some pains or something, or for those that do not even have any symptoms, they will not be aware of it, but later it's going to cause them problems.
Yes.
So the prevalence is about that worldwide. In different countries, you may not, it's difficult to know the real prevalence, especially in Sub-Saharan Africa, where we probably do not diagnose, and people go and take medications for different conditions at different times. Yeah.
Okay, sir. Thank you for that explanation. So, what structures in the body? Because you said that it's when you see the inner lining of the uterus outside of that area.
Yeah.
What structures can we see this inner line of the uterus in the body? What are the structures it can affect?
Okay, I said it is when it is found outside the inner lining of the uterus.
Yeah.
So when it's found outside the inner lining of the uterus, but it is within the uterine muscle, it is also an endometriosis, but they call it endometriosis interna, or that is inside within the uterus, or sometimes endometriosis, adenomyosis, something to do with the muscle of a condition where it is inside the muscle of the womb itself.
Yes.
It is still endometriosis interna, that is within the womb itself. So you can find it. It will cause the same issues it will do elsewhere. Then the structures that are close to the uterus, that are attached to the uterus, like the fallopian tubes, the ovary, the lining that covers these structures in the inside, and then the bladder, the gut itself, part of the diaphragm, and sometimes very distant places. You can find those. You can find the tissue.
There?
Yes.
Okay. So that means it can actually be widespread.
It can be everywhere in the body.
Can it be located in the brain?
It can.
Okay.
Yes.
Okay, so that's a lot of information. So that means it can mimic the behavior of what it's supposed to do within the uterus in those places.
Yes, exactly. So it responds to hormonal changes that occurs within the uterus every month.
Okay.
Every month after menstruation happens, the small eggs that are in the ovary begin to grow. When they begin to grow, they secrete estrogen. And later, the eggs grow big enough to be released, and another hormone, progesterone, is produced.
Yes.
So it changes the endometrium. The endometrium keeps growing thicker and thicker. It's responding to the ovarian stimulation and waiting for a fertilized ovum to come, to be implanted in that soil, like when you till a soil to implant something.
Yes.
It is when this pregnancy does not take place that this is washed out, and there is a road to follow,
Yes.
down through the cervix, through the vagina, and outside. But when you find it in the muzzle of the uterus, or you find it elsewhere, this same thing I'm talking happens. There is a thickening. It responds to the hormones. It gets thickened.
Yeah.
But it increases in size. But when there is time to shed out, it cannot be shed out because there is no road. And so it increases in size where it is and irritates the place.
Okay. Thank you so much, sir, for that explanation. So what can we say causes endometriosis?
When you say causes, it is difficult for us to pinpoint exactly that this is the cause. And in many diseases where we cannot pinpoint a cause, we go back to say that, okay, there are theories. But we know that it is commoner among women who are 30 years to 45 years.
Okay.
That's when they diagnose it often. It is, it can be seen in women who are infertile or have postponed or have not delivered for some time. Maybe they deliver 1, 2, 3 and stop delivery for a long time. It may happen. And it can also be seen, these are risk factors. Those who have had surgeries on the womb, maybe fibroid removed, procedures done, and so on and so forth. Those are the risk factors. But there are theories about how it comes about.
Okay.
We know, for instance, that if somebody's relations are having endometriosis, the person has 6 to 7 chance more than the normal population of having endometriosis. We also, so some of the theories include the fact that rather than menses going out through the normal path, it goes back. So they call it retrograde menstruation. When it goes back, then it will go back into those things around the uterus and stick to them. Another theory says that actually, because the structures that form the female genital organs, the internal organs, they come in a particular way besides the kidneys and so on. When some of them were trapped, they can change form. They call it metaplasia. They change form and become endometrium. And then we have endometriosis at those sites.
Okay.
Well, that still cannot explain why endometriosis is found in many and every site.
Yes.
So people think that they could follow the lymphatic system. It can also follow the blood system.
Yeah.
Or tissues can on their own just change the way, the form they are. The other theory, well, we know it happens. When you do a surgery and endometrium is transported and taken to some other part of the body from the surgery,
Yes.
let's say from the inside of the endometrium, it gets to the muzzle of the womb, it's going to stick there. It gets to touch the ovary, it's going to stick there.
Okay.
So that, if that happens, you are also going to get. So we cannot pinpoint something, but we know that those conditions and those theories I've mentioned are the things that result in endometriosis.
Thank you so much for that explanation. This is
you.
a lot of explanations.
It's too much, huh?
Because well, we can't really pinpoint and say this is what, don't do this and you'll be saved from endometriosis. Thank you so much, sir, for that explanation. So viewers, we'll be going on a break now, and when we come back, we'll keep talking about endometriosis. Thank you.
A global platform to celebrate women, telling narratives of strength, of freedom, of change. Welcome to invigorating stories from the lenses of women around the globe. Welcome to the Women's International Film Festival, Nigeria, WIFIN, West Africa's first Women's International Film Festival, happening on the 4th and 5th of March 2022 at 9 a.m. and 5 p.m. respectively at the International Conference Center, Abuja. Visit wifin.global for tickets, festival programs, and festival discounts, including flights and accommodation. WIFIN is powered by Girls' Voices, the Girl Nation Academy, and the French Embassy in Nigeria, and proudly supported by TSTV Africa, Zenith Bank, Aero Contractors, Vento Furniture, Ace Solicitors, and other magnificent partners. Join us for WIFIN 2022. Let's disrupt the world together.
And welcome to Clear on Health.
TSTV, connecting your world.
Welcome back, viewers, to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. With me in the studio is Dr. Da, and we've been talking extensively about endometriosis. So before we went on the break, we defined it. We also talked about, where it can happen in the body. So, sir, what is the typical patient that has endometriosis? How do they present?
Well, the typical patient is the person that I described, maybe a woman in her 30s to mid-40s.
Yes.
She's within the reproductive health period. And if the books, some may tell you that she's Caucasian, but it is because maybe those of us in sub-Saharan Africa, our health-seeking behavior is low, so we do not diagnose it more often.
Yes.
But any woman within that can get endometriosis.
Okay.
The typical patient will be someone who has had certain risk factors that her sisters or her cousins have it, and maybe she has had some of the surgeries, or she had some procedures too close to the menstrual cycle, not a little far away. That is the typical patient. Now, she will, 25% of the patients do not.
So they have the chance of having same illness. So what are the symptoms?
That's what we're saying. The symptoms that we can find around menstrual cycle are those of bleeding too much.
Okay.
Bleeding too much may mean that someone who is used to seeing her cycle for 5 days is now seeing it for more than 7 days. Bleeding too much may mean that cycles that were supposed to be every month is now occurring even in between. Bleeding too much may mean that you are bleeding for the normal number of days, but the amount is so much. So all those things, polymenorrhea, epimenorrhea, menorrhagia, all those terminologies that you'll be told, those are what they mean. Then the other one will be, of course, they'll present with infertility. Either because the period that she has not taken in has allowed endometriosis to come on, or endometriosis did come in, and because it causes some irritation to the pelvic side and to the movement of spermatozoa within the pelvis before it meets with the egg, it can cause infertility. Then the other one is pain, which is the main thing, the main trouble that those who are creating awareness are very interested in people to have, because do not assume that your pain is, like people who have fibroids, they said, no, I have big tummy, and they are used to it. And say, I always have pain, and they are used to it. No, you should check it out. Those who have pain, some people have pain during the menses, that is exaggerated. Some people have pains all the time, so that we call them pelvic cripple.
Pelvic cripple.
Cripple. When she's sitting down and you want her to get up, or maybe somebody who is elder who has come in to everybody to get up, she finds it difficult to get up. Because getting up is so much pain. That's part of the worst form of pains that the person can get. If the person is having sex, she'll have pain during sex or immediately after sex. Some of the pains can come during period and get worse because of the endometriosis, or it can happen, or it can exceed the period of the pain, of the menstrual flow. Pain will occur before, during, and even after the menstrual flow. All these are a group of pain that is caused by the endometriosis. And other symptoms are wherever it finds itself. If it's towards the bladder, it may cause irritation. You would think that the person is having urinary tract infection very often. It may affect the rectum, and the person can present with some pains and stooling often, and you say she has irritable bowel syndrome. It's looking something close to it, but it's not exactly it. So it depends on the organ where it is seated, and it depends on how big it is, depends on the organ is seated and the position is seated, it will cause some pain.
So
pain is a major.
If it is located in, can it be located in the muscle, sir?
Well, it is not impossible because it can migrate by blood and by lymph. So it can get to those points of the muscle. It can also migrate during surgery. So in the muscles of the anterior abdominal wall, it can be there. You can find it also in the muscles around the vagina. You can also find it in the vulva, because it can all migrate to that place.
Thank you.
It can be in the scar where surgery is done.
Thank you, sir, for that explanation. So how do we diagnose it? Because some of the symptoms are actually not specific.
No, actually no single symptom is specific.
Yes, because if you say you're having chronic pelvic pain, some people can just say, oh, my periods are very bad, they're just like that, actually without going to the hospital or pursuing it further.
Yes.
And then if it's happening in the abdomen, or it's just causing them pain, or maybe they are stooling in a particular fashion, so how can we say we diagnose it?
Now, how the doctor diagnoses things is that he takes a history. Even though we say pain in our pelvis, every pain has a character. Even though the pain of infection can occur just on its own, but it is likely to occur in addition to a fever and maybe a discharge. But the pain of endometriosis is not likely to have a fever, nor is it going to have a discharge. Even though she can have pain during sex, just like someone who has infection can have pain during sex, we can eliminate the pain of infection by knowing that the one of endometriosis tends to last maybe a little longer. It can also, part of the history can also tell us that she's had some form of surgery or something, or her relations have it. And Also, when we take history, we said, oh, how old are you? You know, we fixed the age of the person. She could fall within this age group. Or the person could already be having issues with fertility in the first place. That is the history. And then the site where it is found on examination can also give it out. Some can be found in the umbilicus, some can be found one way or the other. But when you do imaging, let's say CT scan, magnetic resonance imaging, or ultrasound scan, you can see it. But what we consider the gold standard for diagnosis is that somebody does a laparoscopy.
Okay.
And, you know, something that is put in using a small hole in the abdomen is something that has a fiber optic where we can now view the abdomen on a screen.
Yes.
That is a laparoscope.
Yeah.
That can make us just say, oh no, these are endometriosis deposits. The trouble this woman is having is endometriosis. That is the gold standard.
Okay. Thank you so much for that explanation. So,
Yeah.
sir, there was something you mentioned about it being, assuming it's around the umbilicus.
Yes.
Now, if it's the patient is looking at it physically, would they be able to identify it?
Well, if it is around the umbilicus,
Is there any
There'll
sign?
be-
Will it
there-
swell?
yes, it is going to swell.
Okay.
It's going to be firm. It's going to be painful. And during menses, those things are going to increase. The swelling will increase, the pain is going to increase, and the color around the umbilicus can begin to get reddish and black,
Okay.
and you will feel it. Even if the patient has some reprieve outside of menses, immediately menses happens, the pains will start again, and the swelling will be hard. You know, when such are there, when they are removed, we can finally take it to the laboratory to check, and they will
Check.
confirm really this is
This is what it
endometriosis.
is. Wow.
Yeah.
Thank you, sir, for that explanation. Are there other conditions that present like endometriosis?
Yes. You know, because of where it is and because of the symptoms it gives, it can mimic a lot of things. If it falls on the bowel, on the sigmoid colon and the rectum, and you can say that, oh, there is irritable bowel syndrome, and you can have pain passing stool. And so when its presentation in the very particular woman is that she has pains when she passes stool, or sometimes even blood when she passes stool, you say, oh, she has hematochezia. Then you may say, oh, is there irritable bowel syndrome? But if there is blood, you are beginning to worry. Do we have a tumor inside the bowel? Those are differential diagnoses.
Yes.
Those are things that look like it. Of course, it looks like infection because the pain is giving you in the lower abdomen.
Yes.
It can give you. On the bladder, it will look like urinary tract infection because it make you urinate a little bit often.
Yes.
So it depends on the organ and the place that it is. If you have an endometriotic deposit on your hand, every month when it's time for your cycle, you are going to get a pain there and swelling. It will follow the months.
Yes.
So you present with that kind of thing. So we will say it is a tumor on the hand or some form of a swelling on the hand.
Yes.
So it depends on where it is and what it's doing.
Yes. Thank you so much for that explanation. So viewers, we'll be going on a break, and when we come back, we'll keep talking about endometriosis. Thank you.
Getting your TSTV decoder just got easier. Simply log on to www.tstvafrica.shop. Select any item of your choice by clicking on Add to Cart. Click on Proceed to check out to make payment. For new users, fill in the required billing details. Check the website terms and condition box to agree. Click on Place Order. Click on Make Payments. On the payment page, fill in your card details. Confirm the amount and click Pay. You can also pay via USSD, bank transfer and other payment platforms. Order your TSTV decoder now and get it delivered to your doorstep. TSTV, connecting your world.
A global platform to celebrate women, telling narratives of strength, of freedom, of change. Welcome to invigorating stories from the lenses of women around the globe. Welcome to the Women's International Film Festival, Nigeria, WIFIN, West Africa's first Women's International Film Festival, happening on the 4th and 5th of March 2022 at 9 a.m. and 5 p.m. respectively at the International Conference Center, Abuja. Visit wifin.global for tickets, festival programs, and festival discounts, including flights and accommodation. WIFIN is powered by Girls' Voices, the Girl Nation Academy, and the French Embassy in Nigeria, and proudly supported by TSTV Africa, Zenith Bank, Aero Contractors, Vento Furniture, Ace Solicitors, and other magnificent partners. Join us for WIFIN 2022. Let's disrupt the world together.
And welcome to Clear on Health.
TSTV connected.
Welcome back to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. With me in the studio is Dr. Da. We've been talking about endometriosis. So, sir, before we went on the break, you said endometriosis can happen in other places in the body. Now, I recall that when I was in secondary school, there was a girl that talked about that when she's seen her menses on her thumb, she has this reddish coloration that happens when she's having her menses. So, sir, can we say that is endometriosis? Because she didn't describe the pain. She just said it's just very, very red. And then once the menses stops, the thumb stops being that red. Can we say that is endometriosis?
Well, every woman has her nuances when it comes to menstruation.
Yes.
Some have a group of pain, some have one thing or the other when it comes to menses.
Yes, sir.
There are some that they say they take sugar, they have more pain, one thing or the other. But from the description you gave, she was likely having endometriosis.
Okay.
Because when the ovarian hormones are released in the blood, they travel everywhere in the body. So everywhere that endometrial tissue is, they will respond in the similar way they will have responded in the endometrium. And so they are going to increase in size.
Yes.
And so she will see it more reddish on her hand. And because, like I said, the one that is in the endometrium will shed outside. But the one that is in her thumb will increase in size and be painful at that time.
Okay.
And so it will just keep increasing.
Okay.
So I think most likely she had endometriosis.
Wow.
Of the finger.
Thank you so much for that explanation. So what would happen? Because like in her case, what is the worst that can happen to that thumb if it's not treated? Because it wasn't like an issue. Then I wasn't well informed. I didn't know. So we just took it like, oh, that is her special case. What happens when endometriosis is not properly treated?
Well, it continues to grow in size. become a cancer, it is a cancer.
Wow.
When the cells now change their form, yes, it now become a cancer. Yes.
Okay. Thank you, sir, for that explanation. So if, assuming a patient has these questions on their mind, how can a doctor help the patient? Because what we are describing now is not the likely thing. It's not malaria, it's not typhoid, it's not the usual thing we see every day. It's very unique. And we are saying if you have menstrual pain, always, it's not normal. We're saying if you have chronic pelvic pain, you have difficulty sitting up, it's not normal. So how can a doctor help the patient?
Now, it is expected that a doctor with the knowledge of what endometriosis is and how it presents and has the ability to diagnose should be the final person to look at this. And first of all, let the appropriate diagnosis be made.
Okay.
When appropriate diagnosis is made, or the doctor, like we are trying to do to educate people, that chronic pain that has been treated with a lot of antibiotics may not just be infection over and over. If it is testing you are used to doing, they will always give you some staphylococcus in the test. That chronic pain that has refused to listen to antibiotics, that you are moving from place to place, may just be endometriosis.
Yes.
So the help is for the doctor to educate the people and also to be able to diagnose that there is endometriosis so that management, the treatment of it can be done. And like I said, a gold standard, which should be available in many places, is a laparoscopy. If the doctor is able to look into the womb, into the abdominal cavity, you will see the nature. And if his laparoscope is allowing him to take a biopsy, he will take a biopsy. And there will be confirmation in the laboratory. But even if there is no confirmation, there is a way that it will look on the laparoscope. And the doctor will be able to say, oh, madam, you have endometriosis. And then he will begin to administer appropriate treatment.
Okay. Thank you, sir, for that explanation. So is there any way we can prevent endometriosis? Because right now, we know that sometimes it happens without our control. But is it possible that, okay, we still tell a patient, if you do this, or you do it for your children, maybe before you take him, you prevent your child from having this disease?
First of all, you know, people try to know what's happening to their siblings and their relations around, and they may have to be careful. But one thing is true, that if you marry early and you are giving birth, and there is no big space between the last child and, let's say you finish your children at 28, you are still in the reproductive health cycle for quite a long time. That exposes you to the possibility. And so maybe people should give birth. I'm not saying they should give birth to plenty people, children and so on, but that could help. Then, if you are having pains and you are going around or you are suspecting something, do not end up with someone who does not know how to diagnose it. Try to get to the person who can diagnose it.
Yes.
Another thing is that if you are going to have a pelvic procedure, let's say we want to do a hysterosalpingograph, you want to do a test that tests the inside of the womb, how open, how patent it is, and the fallopian tubes. You should not do it during menstruation. You should not do it, you know, immediately after menstruation or immediately before. It should be remote from menstruation a bit so that it is not easy to translocate the menses by pushing, you know, the fluid that can now push menstruation into the pelvic cavity. So you should look for someone who knows what he's doing. Then, if there are procedures to be done, they should be done properly. Do not go to a quack. If you had a miscarriage and you need evacuation to be done, a quack may not know where he should stop. You may not know when the womb is empty. And he may keep evacuating in such a way that that pushes the endometrial content into the muzzle of the womb or even outside. And then, if cesarean section, myomectomy, hysteroplasty or any such surgeries are being done, it should be done by doctors that know that I'm careful with the endometrium not to translocate it to somewhere else to cause endometriosis to such a person.
Yes.
So the kind of doctors you choose
Matters.
may help you also, you know, in whether or not you end up having endometriosis.
Okay.
Yeah.
Okay. And if I understand you clearly, sir, awareness is also very important.
Yes.
Very important.
Yes.
Beyond, first of all, you're aware about your own health choices. You're aware about the doctors or the people that should attend to you, and you're aware about the questions to even ask when you meet
That's
these professionals.
Right. That's right.
Yes, sir.
Because what someone does not know, he does not know it.
True.
So when you go to a health professional who does not know it, he is not likely to think in that direction.
Yes.
Neither is he likely to take precautions on the procedures and the tests he's going to do to you, so you do not get that.
Okay.
Yes. And then the pains you are getting, his mind may not go to the fact that let's be sure it's not endometriosis so that we can quickly know maybe how to sort the person out.
Yes.
Yeah. So awareness is very important. So that the awareness and then your kind of health-seeking behavior, you know, when you shouldn't have a pediatric problem and carry a child maybe to a geriatrician. You should take it to a pediatrician, isn't it?
Yes.
Aha. So that is the kind of awareness that people should know. It is your body. You should know what kind of physician is appropriate for you.
Okay.
Yeah.
Thank you, sir, for that explanation. So, sir, for a patient that already is diagnosed,
Great.
what are the options for management? How do we treat these patients?
You know, if someone has been diagnosed, we could decide that, okay, this is not a very serious case, and let's just manage the person with expectation. Is it a pain that is not so severe? So if it is not, we may begin to say, okay, let's watch it and see. Maybe it won't get worse. Just an expectant management.
Okay.
If someone is already, say, 48, 49, and there's endometriosis, we may also apply the expectant management. Could we wait a year or so, hoping that at menopause, things may get a little bit better? Even though if it's already gone so far, so deep, the pains will still be there. But you may decide to do expectant management. You have weighed the scale of pain and the suffering of the patient, and you just said, oh, rather than give you medication, let me hold on, let's watch a little, maybe the things will abate.
Yes.
Okay?
Yeah.
So that's one way that you are given expectant management.
Okay.
The other one is, during the expectant management, you may also want to give non-steroidal anti-inflammatory medications, just things to ease the pain one way or the other. Another thing is, you go back to the pathology itself.
Yes.
Because the ovarian hormones are causing this in a cyclical way. Okay, can you introduce those ovarian hormones so that it is no longer cyclical? They are given continuously. So the body will not recognize that the functions that they are supposed to be, when I say cyclical, the hormones are given at specific periods, the body produces them at specific period, and they do what they are meant to do, and after that, the body stops producing them, and your body goes back to normal, and every cycle they do again. So, but if you blunt that out by giving a continuous dose of those hormones, like oral contraceptive pills, or that has estrogen, progesterone, you give a continuous way. If you break it, it's going to worsen. But you just keep it continuous. So the hormones are not given in a way as to allow it to grow.
Okay.
If any time we want to make a woman not to menstruate, we can make her not to menstruate. We can make her not to menstruate forever just by giving medication. So if that happens, that tends to lessen the pain.
Okay.
Another help that is available by way of medicine is that we can actually try to blunt out completely as if we have surgically taken out the ovary. By giving a hormone that antagonizes completely those hormones that are produced by the ovary. There are hormonal preparations that we call gonadotropin analogs. You know, when we give them, they block the hormones, the sites that the hormones will act.
Yes.
And so the body, including the endometriosis sites, does not feel it. And so the person ends up not having the pains, and the thing does not progress.
Okay.
We can also give things like danazol that try to oppose the same hormones as well. You know, so those are some medical ways that we get to manage. But there are also surgical ways. Some people have so much pain that you need to do something because it's so big, it's so deep,
Yes.
or even if it is small, it's still causing problem.
Yes.
So either we open laparoscopically, we go inside to burn what we can burn, or if it has caused adhesions that are causing issues, we may try to separate the adhesions, even though they may form again.
Sorry, sir. Just hold that. I want us to explain what adhesions are because, you know, we have a lot of people listening.
Something, whenever the organs in the body
Yes.
naturally are meant to smoothly flow over the, you know, the gut, is the intestines are constantly moving.
Yes.
That's why you eat food today without noticing. In maybe 18 to 24 hours, depending on how peppery the food is, you may go to the toilet,
Yeah.
or if it is vegetables, may run faster, and other food will stay longer.
Yeah.
But after some time, it comes out through the anus. It has traveled like 8 meters or more, from the mouth to the esophagus to the stomach. It keeps moving.
Yeah.
The same way, the ovaries are lying free. The fallopian tubes are lying free. So there is a lubricant in the abdomen that makes organs move on top of one another without sticking together, without adhering to one another. When they adhere to one another for one reason or the other, they will adhere, they will stick to one another. If there is infection inflames both the surfaces, and they can easily stick together. They will stick together if we traumatize in operation the body of this and the body of this, so they will stick together. They will stick together if endometriosis is in between. It is also causing inflammation to this and to this, so it will make them stick together.
Yes.
Adhesions are the sticking together of the different organs in the body.
Yes.
So sometimes if they stick together, they will cause pain because the boy will not move the way it wants to move. Neither will the uterus. If you lie down, the uterus falls back. If you sit up, it tends to fall forward. If you lie on the side, it tends to fall on that side. It's free, but that freedom is no longer there. And the limitation of that freedom causes pain.
Okay.
So sometimes we will have to do the separation, hoping they will not stick back. Then sometimes it has formed, because it's secreting over and over and it's not getting a place to egress outside. It forms a tumor, a growth inside that begins to grow big.
Yes.
And when it grows big, it can impinge on the rectum and cause trouble giving a person's stool. It can impinge on the bladder, cause trouble urinating, impinge on the bowel, and sometimes cause trouble to the person.
Yes.
When that happens, we need to take that out. That will be also a surgical way of doing it. So, and the surgical can be either we do a laparoscopy, that means we enter in a minimal access way, in the sense that we're not cutting all, but entering 2-3 points.
Yes.
Or we cut completely open so that we can clearly see and remove. Those are the helps that we can give a woman who has endometriosis.
Thank you, sir.
So she doesn't live with pain.
Yes,
Yeah.
Thank you for that explanation, sir. So,
Thank
sir,
you.
you said something about menopause when you were talking about medical management.
Yes.
So, after menopause, can we say someone is free from the symptoms of endometriosis?
After menopause, some symptoms may abate.
Okay.
Symptoms that come whenever the hormones of the ovary
Yes.
trigger more secretion, which irritates the tissues around.
Okay.
They will abate because there are no more enough hormones produced to cause that effect
Yes.
in a cyclical manner. But if there were the sticking together that we spoke about, or the enlargement that we spoke about, if they were there, even after menopause, the pains may continue.
Wow. So it started as endometriosis and then has gone to cause other things.
Yes. So
with other organs.
So those things will continue unless
yes,
you intervene.
Yes, I think this is leading us to the complications. We've mentioned, I see that the signs or the symptoms are interlaced with some of the complications.
Complications, that's right.
So I just wanted us to just run through some of them.
Some of the
Yes, we've already talked about tumors. We've talked about adhesions.
Yes.
So I just want us to just talk about, and tumors can be anywhere, depending on where the endometriotic tissue is staying.
Yes.
So if it's in the pelvis, it can press on, you mentioned, pressing on the rectum and then
okay, we've mentioned adhesions.
Yes, sir.
And the more pains they can cause. We mentioned that it may cause growth and collection that will cause trouble to people. Because those things are happening, sometimes we don't forget, even though it may come and be seen among those who are infertile, it can cause infertility. Infertility because those adhesions we've spoken about are not may affect the fallopian tubes, so that sperm cannot really run to meet the egg because of those adhesions. It can also be because there are certain pathological things that happen. Because endometriosis is there are phagocytes that come there, and immediately they are made to be too many. Whenever sperm comes close, it will affect the motility of the sperm or of the egg, and they can actually run and even affect the sperm and the egg. And so it's difficult for them to join.
Yes.
Not only that, if it affects the womb itself, it's difficult for the womb to give the support that is needed for a fertilized ovum. So even if you achieve a fertilization of the ovum, you are not going to achieve an implantation because the muscle of the womb has been distorted somewhat. So it can cause infertility. Sometimes if it finds itself in many places, we said it can be found in the vagina too. It can cause certain kinds of bleeding that can be so severe, from the vaginal wall this time, can be so severe as to affect the health of the person. If endometriosis finds itself in the brain, the brain is made in a way that it cannot contain anything extra. So if it's there and it's growing every month, it's likely to cause a lot of headache.
Yes.
And a lot of pressure on organs, that the person's pain will increase much more. Same thing if you find it in the spinal cord, you find that. Same thing if it is somewhere in the bowel, that once in a while it may be, let me say, scratched and made to bleed, and the bleeding can increase. These are some of the complications of endometriosis.
For that explanation. So, sir, what are your last words about endometriosis? What do you think? We've run through a lot of things, definition, prevalence, we talked about.
Well, generally, because we are in an endometriosis awareness month,
yes,
I would like every woman to know that this is a possibility. Because it is a possibility, when something has different causes, at least the causes that you can prevent, you should work on them. So, for instance, do not go and have an evacuation from a quack who can perforate the womb, or maybe curate it so much that the tissues in the inner lining of the womb gets to where they are not supposed to get. It is going to cause endometriosis. Do not assume that you have to take all the kinds of antibiotic in the world because of the pelvic pain you are getting. You should try and make sure that a proper diagnosis is made, so that if you are lucky, you will not be made to become a pelvic cripple, which I mentioned earlier. It is one of the complications, that the pelvis will be frozen. Everything is gummed together, sealed, like when you put cement in water. It will be completely sealed, and the organs will not be able to perform their work, because So you can avoid that by being careful whom you go to and how you seek your health. Now, because men are listening to me and women are listening to me, you may also have a sister. If you have elder siblings that already have endometriosis, then you should begin to be perhaps more extra careful concerning the things that I have already spoken, so that you do not fall into the category that has, the issues. And then I still encourage people to marry early. When I say marry early, I'm talking about maybe from 18 years upwards, 18 and early 20s and late 20s and early 30s, rather than waiting for very, very long. So that even if endometriosis is going to set in, the pregnancy state will delay it each time. Somehow, will delay its progress. Because when you are pregnant, the cyclical production of the hormones of the ovary will not take place. And so endometriosis will not advance even if it is there. So those are some of the advices I think I can give my sisters.
Thank you, sir, for that advice.
Thank you.
Okay. So viewers, we've been talking about endometriosis. We talked about what it is, how to recognize it, how it presents. We also talked about some of the complications, talked about how we can diagnose it. We talked about, the treatment and management for it. With me in the studio is Dr. Da, and my name is Dr. Fumilayo Olusoji. Thank you so much for joining us. Till next time when we meet on this station and talk about other health issues. Thank you. Bye.
Getting your TSTV decoder just got easier. Simply log on to www.tstvafrica.shop. Select any item of your choice by clicking on Add to Cart. Click on Proceed to check out to make payment. For new users, fill in the required billing details. Check the website terms and condition box to agree. Click on Place Order. Click on Make Payments. On the payment page, fill in your card details. Confirm the amount and click Pay. You can also pay via USSD, bank transfer and other payment platforms. Order your TSTV decoder now and get it delivered to your doorstep. TSTV, connecting your world.
A global platform to celebrate women, telling narratives of strength, of freedom, of change. Welcome to invigorating stories from the lenses of women around the globe. Welcome to the Women's International Film Festival, Nigeria, WIFIN, West Africa's first Women's International Film Festival, happening on the 4th and 5th of March 2022 at 9 a.m. and 5 p.m. respectively at the International Conference Center, Abuja. Visit wifin.global for tickets, festival programs, and festival discounts, including flights and accommodation. WIFIN is powered by Girls' Voices, the Girl Nation Academy, and the French Embassy in Nigeria, and proudly supported by TSTV Africa, Zenith Bank, Aero Contractors, Vento Furniture, Ace Solicitors, and other magnificent partners. Join us for WIFIN 2022. Let's disrupt the world together.
And welcome to Clear on Health.